You're welcome once again to this channel. I got a couple of questions asking, is nursing school education outdated? Is there any changes in the nursing education systems before and to now? Is there any changes? Is there any changes as regards the prerequisite requirements? Is there any changes in the curriculums? Is it outdated? Is those things that are being taught, is it still what is there? Is those experience that we have in the past, is still what is still existing? This video is going to be talking about nursing school educations. Is nursing school education still outdated? If this is what you would like to watch, please sit down, grab your popcorn and enjoy the rest of the video. And now back into the video. Is nursing school education outdated? Okay, so this question come up when I was discussing with a junior colleague of mine, and trying to discuss how nursing education back then during our own time was, and then this is like 10 years ago. And we'll tend to discuss, is there any changes in the prerequisite qualifications requirements? So honestly, presently it's still though quite alright, there is changes now in the prerequisite requirements, still the same during our own time, but those before us as a year back, as 20 years back, so we have the requisite requirements where you have to have your O-level requirements and you must fulfill present before then you must have a pass in English and Maths and have credit units in the other science subjects including physics, chemistry and biology. But presently now during our own time, you must have 5 O-level credits, and you can also combine 2 sittings. This should not be more than 2 sittings. In as much as you could have 5 O-level credits, you are good to go. And this is the requirement that is still obtainable for you to be able to study nursing, especially here in Africa. Let me know that country that you are from. What is the prerequisite requirement for an individual to study nursing in that your country? Maybe you are watching me from USA, you are watching me from United Kingdom. What is the prerequisite requirement that you need to have? Let me know in the comment box your prerequisite requirements. So, but in Africa, especially in Nigeria, you must have 5 O-level credits, including English, mathematics, and you must have that of credit in the physics, chemistry and biology. These 5 courses are mandatory for you to have credit in those courses for you to be able to study nursing back here in Africa, especially in Nigeria. Now, having said that, so you see, back then you don't need to do JAMB before you could get admitted into nursing, but currently now you have to do JAMB. You have to register with JAMB. JAMB simply means Joint Admission Matriculation Examinations. This is the board that conducts admissions examinations for any individuals, any persons that want to seek admissions into tertiary institution in Nigeria. So you must do JAMB and you must have the minimum scores needed for you to be able to get admitted into university, into college of any tertiary institutions in Nigeria. So back then during our own time 10 years ago, as at 2010, you see there's no compulsory you must have JAMB. But then those that want to study nursing in the university, you must have your JAMB at hand. You must have your JAMB scores at hand. You must get a correct score. A minimum score is needed for you to be able to get admitted for nursing, for you to be able to be qualified to do the assessment by the schools that you want to do. But during our own times, there is no need, especially if you went to the College of Nursing, no need for you to have JAMB score or register with JAMB. Then also other things that change is after having you obtain the JAMBs, then you still need to do an exam, and you need to obtain the form in the schools and do an exam. Currently now you need to do an exam with the schools that you want to get admitted into, being it College of Nursing, being it university. So you need to obtain the form, get examined by the schools, get the minimum scores, and get being admitted into the program, nursing program. So another thing that I would also like to talk about is the aspect of PTS. PTS, we call it back then, when you are being enrolled into nursing, you have been newly admitted into nursing program, and for the first 6 months of of the training, you are being you be assessed. An examination will be conducted, which will determine if you fail, you'll be put out of the program, the nursing program entirely. Isn't this sounds awesome? Isn't this sound somehow? But then now, the in Nigeria presently, the systems, the method of using PTS is no more the way it is. Your assessment starts from the day one that you are being admitted into the school, from the day one that you are having your examinations. Your scores begin counting from there, and presently now you now have HND being conducted. You can go to the College of Nursing, have your ND-HND, or go to the university and have your BSc straight away. So your assessment starts from the time that you get admitted, from the first times you got your examination conducted, being assessed. So it is not like during our own time, for the first 6 months you fail the examinations, you are put out of the program. In fact, the first 2 years, especially midwifery back then in 2010, 11, 12 and 13, you fail the examination, even after 2 years you'll be put out of the program. This is so awesome. A lot of students have been put out of the programs, which got them thinking, or they have to even think of doing another thing. If those ones that have the mind that could even say, oh, let them reapply for the schools, for the nursing program. So the age of PTS is no more in place, and also the curriculum. Yes, curriculum is being updated. There are a lot of courses that are not being inserted into the curriculum. So back then, those one before us, so those one that are having like 5 years, 10 years ahead of us, the introduction of computer is not into their system there. So but during our own times, the computer is now being introduced, and then back then, as at 2010, so we will see the use of normal clinical examinations being done. Unlike now that you now have the use of Husky, objective structured clinical examinations, where there will be stations where some parameters will be there for you to be able to be examined on in those stations. So this is what I say I should share. The nursing education system, the curriculum is also changing. There are a lot of new things being coming in. Those things that are there before are no more there. So it's moving forward. There are things changing. It's dynamic. The changes are happening in the nursing education system, especially here in Nigeria, in Africa. So the way it used to be before then is not the way it used to be, ranging from the prerequisite qualifications, the curriculums, the mode of examinations. In fact, currently now, most of the council examinations all across the globe are now employing the use of CBT, the use of CBT, objective structured questions and the likes. So it's now being used, unlike during back then 2010 in Nigeria, where you could have the theory examination in combination with the objectives. So if this is what is interesting you, if this is what interests you, let me know what has changed in the education system in your own country, wherever you might be watching me from. And thank you for watching. Don't forget, like this video, give it a thumbs up, and subscribe to my YouTube channel if you are new on this channel. You are the ready. Thank you. Bye.